we got Brock here today. We're gonna be doing some shockwave on his Achilles. Here we go. About 500 clicks in, halfway there. Right about there too. About halfway done. As an endurance athlete like Brock, he's doing long bike rides, long runs. Good job. Very good. All right, Brock. Well, good job.
Thanks, Justin.
It's gonna help a lot. A lot of times you see chiropractors giving adjustments and you see a montage like we just showed you. On the second half of this video, we're going to go into assessment and figure out why we're adjusting, where we're adjusting, and so you have a better understanding of what we do as chiropractors. I hope you find this valuable and educational. If you like it, click like and subscribe. I'll see you on the next video. Hey, Brock.
Hey, Justin.
Good to see you. Well, we got Brock here today. We're going to be doing some shockwave on his Achilles. He's already received 7 treatments on his Achilles, and that was from kind of excessive running. He was having Achilles tendonitis, pain when he was kind of pushing off. He's walking flat-footed and not putting pressure on that Achilles was fine, but as he kind of overdid it running, was definitely feeling it, tissue tight, restrictive. How was your experience with the shockwave so far?
It was great. So we started it in about, I think it was early June. It was very tight. It was, I'd feel like almost kind of locked from the heel up to the calf. I think after 2 sessions, I did a race. I've been running 2 days a week. When I'm an old runner, I used to run a lot more, but about 2 days a week is what I do now. After about 2-3 sessions, I did a race and was able to make it through 5K with 0 pain, just slowly. I could feel it. It'd be a little tight still, but the pain wasn't gone. I wouldn't say it went away, but it took the pain off. It was, There's tightness there, and that's just what I'm going to live with. But taking the pain off is a real thing that I could do. So I wouldn't, because the main thing I was worried about is still moving with a gait that would, if you're leaning towards it. But since the treatment, that was the biggest advantage, was the pain was gone, the tightness. So I was able to just normally run. If I then I could warm up and do it in normal way, and then it would, during each race, I did the Firecracker 5K and then the Wharf to Wharf, and made it through both of them, basically pain-free. Awesome. So I was really excited about that. Yeah.
So we've done a total of 7 treatments. It's been a while since we've done a shockwave, so we're just doing a little maintenance to keep that tissue regenerating, get that collagen, those elastin fibers and collagen fibers, keep them nice and healthy, get a nice blood supply to the Achilles tendon. And so this is a very effective treatment for anyone who has Achilles tendonitis. And like the Achilles, when it tightens up, it can start going to the bottom of the foot, affecting the plantar fascia.
You can feel it from basically there when it was bad. It would basically start up here or start down here, but go all the way around through the hole. And
then on your left ankle, you had a little ankle sprain.
Yeah.
And so right through this ligament, there was some pain. Is it tender as I palpate through here?
A little bit right up on that part right there, yeah.
So we're gonna do a little shockwave right here as well. Get those blood vessels growth and break up any scar tissue and help regenerate that ligament. Let's get started. Let's start with the Achilles first. Let's have you lie face down. We're gonna start at point 2, it's where we left off at 4 hurt. Here we go. Give me numbers 0 to 10, 10 being the highest. We don't want to go over a 5 or a 6.
Right.
So, and then we can always bump it up if you're not feeling it at that point too.
Yeah, you can feel about right there. It gets to about a 5. Right at the heel. Yeah.
So we're gonna stay right there. Let me know if you need a little break. We're gonna kind of change the angle as we work around that.
Yeah, that's just, it's right about 5 at the heel. Otherwise it's 3 or 4.
And we're gonna come around on the inside of it. Tenderness through here.
Minimal, yeah. Right there is when
Right as it attaches right on that calcaneus. A little tender there.
Yeah, that's the tender spot.
We're gonna come all the way up to here, see if there's any hot spots.
Nothing in there. Pretty good.
Come back down. Stop me at the most tender point.
3. There we go, right in there.
Right there. So let's stay right there for about 10 seconds. About 500 clicks in, halfway there. Right about there too. We're gonna go on the underside where there's a little plantar fascia connection, see if there's any hot spots here.
Got a 4 probably at the bottom.
Right there?
Yeah.
Yeah. So this is a common place where people feel it for the plantar fascia. In the morning, it's tight, and so when they step onto the floor, they can hardly walk. They can't really flex the foot because it starts pulling on that. And if left uncorrected, it can start to develop a bone spur right in the calcaneus. So we want to prevent that. Get that plantar fascia right there too.
Yeah.
Is that a 4 or 5?
Probably a 5 right there. Just because it's the arch.
Yeah.
Somewhat ticklish anyway.
Yeah. And how would you describe what you're feeling?
I mean, it's just a kind of a dull pain. It's not a sharp one. There's pain, but I wouldn't say it hurts. It's just a weird, different kind of feeling, but it's definitely tolerable. It's only the initial shock of it that's really, you feel, then it kind of dissipates. I mean, it's not as bad as when it hurts, when the actual pain hurts. So that's the key barometer.
Got 100 left, almost done. This is a common thing. Once people start to have that tendonitis, a lot of times they run the risk of tearing the Achilles, and then you're in a boot for a long time. Okay, there you go.
Yeah.
All right, let's flip you over. Let's get this ankle.
Okay.
We're gonna get right into this little ligament, come through here, map this out. A lot of times what happens, like with my soccer players and stuff, they roll their ankle, it overstretches that ligament. Grade 1 sprains typically right there. Sometimes grade 2, they start to feel anything down here as I palpate.
Yeah,
right
a little bit, yeah.
And then right in the back at all, right through here.
A tender bit. I mean, it's top. The top is the most, but it definitely.
So
I mean, it was a pretty good size. It was definitely a solid sprain.
Yeah. So here we go. Between 0 to 10.
Yeah, right there, probably 5. Right away, as you move away, it's about a 4 in that area.
Right there. So we're gonna hang out right there.
Yeah, that's a good.
And then we're gonna sweep under. Stop me at any hot spots through here.
Right about there.
Right about there. So now we're gonna hang out here. Do about 100 clicks through here. 4 or 5 about.
About the same, about a 4 or 5. Yeah, 4.5 or so. A little less as you move away. Right there, so about 5, right there.
Sometimes these have a hard time healing too because they don't have the best blood supply to those ligaments and everything. So this is going to help with the blood supply as well as the collagen. Now we're going to come all the way in the back of the heel, kind of through here. Any hot spots right there?
About a 4 for that one, yeah.
Okay, great. About halfway done.
Yeah, that's probably right the biggest spot, right in there, yeah. But yeah, that's the thing on the pain is it hits it and then it kind of dissipates down. It doesn't stay at the 5 the whole time. I mean, it probably goes a little higher and then it comes down and then it's the 4 or 5. It's definitely a tolerable pain. It's just when you hit it, you have to kind of be ready for the initial hit. Oh, right there, right there. Yeah, that might be a little higher. Call that a 6.
We got about 45 clicks left, almost done. There we go.
All right. Yeah, that one little spot hit for a second pretty.
Yeah.
It's good though.
Good job.
It needed it.
All right. All right. Brock is also one of our VIPs, so he knows that it's really important to keep his spine nice and aligned, keep those nerves flowing, especially in his low back. Those nerves go all the way down to the Achilles, down to his foot. So let's check your spine real quick and give you a little adjustment.
That's great.
So we're going to do a little leg length check. This one looks pretty even. Go to position 2. You can see his right hip kind of shifts up a little bit as we bring him into that. And then we're going to go into position 3 and see how. Yeah. So as I bring this up, he kind of rotates here. There might be a little tight on the quads. And then also we just want to check to see the SI joint. We're going to just come down into here. We're going to go 1, 2, and 3. Felt it a little more.
Yep, 2 is it for sure.
So a little pressure point work right through here. We're just going to kind of get some motion movement. It's right on what we call the S2. So if your hips are kind of getting this rotation, it could be affecting things downstream. So as an endurance athlete like Brock, he's doing long bike rides, long runs, and so if it's a little off, and he's doing it for hours at a time.
Yeah, 5-6 hours.
5-6 hours. That's gonna have a little bit of effect. So let's just come up through here and help in here. We go L5, L4, L3, 2. That's still not bad. Yeah, and the rib cage right here. So we want to open this up as well. Yeah, right there. And we can come up through here. So right through this line. And so this line probably is affecting here. So as we open this up, so let's give this a little adjustment first. Take a deep breath in. Exhale. Good job. Release it good. Good. Let's flip you over. Bring you over here. Good. Get right there. Over nice and slowly. Just give a little safer. Very good. Now when that rotates that way, the shift in the pelvis, this is what we call an AS, left AS ilium. So instead of pushing it that way, we're gonna actually pull it down that way. So we're gonna traction in here, see where it's moving. Good, right there, let that go. Very good. That released real good. Yeah, a little down in this 4-5 level. And then right at the top is C1 right there. So C1 is really important. It can affect our sleep if it's off, our fatigue, our mental clarity, and anxiety. So as we kind of calm this down, we're into the parasympathetics, which opposite of fight and flight, more rest, digest. Let's get the C1 first. It's probably the most important. Traction. Open that up. Good. Very nice. C5, 4, little lock there. So this is where we want to put motion. Very good. Excellent. Whew. It's gonna make your body work that much better. Yeah. Let's also do this. Arms up towards the ceiling. Good. Inhale. Exhale. Elbows down. Lock my arms in. Good. Good job. All right, Brock. Well, good job.
Thanks, Justin.
It's gonna help a lot.
Definitely.
Keep you nice and healthy.
Thank you so much.
Good seeing you.